Alright guys, welcome back. Let's see what's happening between our borders in county and
governors, CS, PSS, distinguished ladies and gentlemen, good afternoon. I'm Jambo. One of the foremost, non-negotiable and irrevocable commitments we made to the people of Kenya was to deliver the constitutional right to health in tangible, inclusive, and practical terms. We pledged to build a robust, responsive, and equitable healthcare system that serves and saves lives, empowers communities, and strengthens our nation. Nearly 3 years into this administration, we have made bold and significant.
in case you are watching this channel for the first time, kindly please click that subscribe buttons, then allow notification buttons to be on. Whenever you're producing a video like this one, YouTube will automatically giving you a notification. And to the subscriber, I really thank you and appreciate you for this support.
Strides towards the realization of universal health coverage and undertaking whose fulfillment has been postponed for far too long. You're all aware that UHC was part of the NAC manifesto. It was in the Jubilee manifesto. It was in the Azimio manifesto. It was in the Kenya Kwanza manifesto. And we've been trying this universal health coverage for a long time. The governor of Nyeri just said that his county was among the 4 counties that worked as trial counties on universal health coverage. But at that time, we didn't succeed. Our vision is being realized through comprehensive health financing reforms, the digitization of health delivery, and the development of a skilled and motivated workforce. To anchor this transformation, you will recall that I signed into law 4 critical pieces of legislation in 2023: the Social Health Insurance Act, the Primary Health Act, the Digital Health Act, and the Facilities Improvement Financing Act. I must thank the Council of Governors and the counties and both houses of Parliament for working with me in making sure that these pieces of legislation were enacted to form a solid foundation for the delivery of universal health. These laws form the backbone of our healthcare overhaul and define Kenya's path to a truly people-centered and resilient universal health coverage. Additionally, last week, Cabinet passed the Quality Health and Patient Safety Bill 2025, which is now in Parliament. This bill aims to end malpractices through strict licensing, clear standards, and a new Quality Healthcare and Patient Safety Authority to enforce patient safety and accountability. This law was supposed to be among the 5, but our hands were full at that time, so we decided to carry on with the 4. But now I am happy that Parliament is seized of this law, and shortly we shall actualize its passage. Ladies and gentlemen, today marks yet another decisive milestone as we officially launch the National Equipment Service Project, a transformational and innovative initiative that is set to revolutionize healthcare infrastructure and service delivery across Kenya. This project is a 7-year strategic initiative aimed at upgrading and modernizing medical equipment at both national and county healthcare facilities. It will ensure that hospitals across Kenya are equipped with cutting-edge diagnostics and treatment technologies accessible to every Kenyan wherever they live. Through this program, we are shifting from a fragmented and costly medical equipment supply system to a smart, collaborative approach to healthcare delivery. As was said by the Chair of the Council, this is a joint project, a joint program, a joint undertaking between the national government and our counties. And it is because I realize too well that health is a devolved function, and we need to harmonize between policy and delivery. And I'm very proud of the cooperation that I have enjoyed, my administration has enjoyed with the Council of Governors in making sure that together we deliver on this promise, constitutional right of health to the people of Kenya. By leveraging bulk procurement and centralized payment system, we are eliminating the needs for counties to make upfront payments for essential medical equipment. This cost-effective and sustainable model guarantees that equipment is not only installed, but also consistently maintained, thereby ensuring consistent and reliable service. If you look at the numbers of the equipment we are going to deploy in our facilities, it is going to be to an estimate of about 200 billion shillings. Just imagine if we were to look for 200 billion shillings. I don't know where the counties would find that kind of money. It would be an impossible exercise. But innovation is what has enabled us to get here. The manufacturers, when we engaged with them, they wanted to be assured of how they will be paid if it is going to be fee for service. When they realized that we now have a fund, then they undertook the exercise and they told us that we want a unified payment system, that they will not have to go to this county and this place and that governor and the other person to be able to get paid for the services they will have offered. And that is why, again, we sat round a table with the Council of Governors and we agreed on the IPA that now gives us the wherewithal and the ability to be able to service this equipment in terms. As you know, the last medical equipment service, which ended up being MES, and it almost became actually a mess because it was quite difficult. We had many challenges. And even servicing, in fact, the biggest problem we had with that program is that some of the equipment did not even get to being installed. They were in boxes, way after we had paid for them. The other problem is that some of that equipment was not in use because of a fuse here and a small repair there, lack of reagents here, lack of something small there. This time round, together, we have configured how to overcome those challenges. Now, it is the responsibility of the manufacturer and the vendor to make sure that the equipment is installed, the equipment is working, the reagents are available. All we will be asking for at the end is a service. And we only pay for the service. Everything else is the responsibility of the manufacturer and the vendor. And I want to commend all of us for doing this together. The medical equipment service, which we are now phasing out, required significant upfront capital and lacked clear service level agreements, leading to frequent downtimes and compromised care. The lessons learned have informed the design of the new program to be more efficient, more accountable, and obviously more sustainable. Under the fee-for-service model, neither the national nor county governments will need to budget for equipment procurement. Our private sector partners will bear the cost of installation, as I have said, servicing, and maintenance, placing no financial burden on public health facilities. This project is firmly anchored in the collaboration between national and county governments. I thank and commend the Ministry of Health and the Council of Governors for their steadfast leadership on this initiative. I also applaud the 45 counties that have already signed the Intergovernmental Participatory Agreement, a critical step in ensuring the successful rollout of the National Equipment Service Project. I'm sure I'll find out from the Governor of Nairobi and the Governor of Kiambu whether they have all the money to buy all the equipment that are required in all the facilities in their counties. I will be very surprised how they'll be able to do that. Since June 2025, over 60,000 medical services have already been delivered in 29 health facilities across 18 counties under this project. We have installed vital equipment, including CT scanners, digital X-rays, ultrasound devices, and modern laboratory systems. CS Duale has already given you the numbers of where we are with all the equipment that has been delivered, that is on the way to being delivered, and all the way to December, we will be working with the manufacturers and the vendors to make sure that they keep their part of the bargain. Let me emphasize, ladies and gentlemen, that this is not just a project. This is just the beginning. We shall not rest until every public health facility in every ward, every constituency, and every county in the Republic of Kenya is fully equipped with the tools and technologies and equipment required to deliver quality health. No Kenyan, regardless of income, status, or location, should ever be denied medical attention due to lack of equipment. Alongside infrastructure, we are also building a comprehensive digital backbone for healthcare. So far, the Social Health Authority has registered 25.2 million Kenyans and contracted over 11,000 health providers, including hospitals, clinics, and health centers in every part of Kenya. Since October 2024, SHA has paid a total of 56.4 billion, comprising 49.7 billion from the Social Health Insurance Fund and 6.7 billion under the Primary Health Fund. This digital transformation is giving Kenyans faster, more transparent, and more dignified access to health. I saw some stories in the media alleging that Social Health Authority has paid less money than NHIF. What a fallacy. I mean, in a year, the most NHIF ever paid was between 22 and 25 billion shillings. In 10 months, SHA has paid 56.4 billion. In fact, by the first anniversary, SHA will have paid 3 times what NHIF ever paid in 1 year. So I request the peddlers of narratives to check their facts, because facts are very stubborn, and numbers tell the story more than words can. Let me also say this, that we are looking at what we can do again together as we look at these facilities. How do we make sure that no Kenyan is left behind because of income? I just had a meeting this morning with the leadership of our Bodabodas, and we have shown them the difference between what was offered under NHIF and what is being offered under SHA. And the difference is like day is from the night. And it is because we realized that we want to lift the most vulnerable in our society. We want to give opportunity to the people who are most vulnerable so that we can move along with them as we make our journey into the future. Allow me, at this juncture, to address something of serious concern to many stakeholders in the healthcare sector: fraud. Yes, fraud. There are those who have exploited or are still attempting to exploit our healthcare system for personal gain through fraudulent claims. The digital infrastructure we have put in place is secure, intelligent, and highly resilient. In fact, we are in the process of installing artificial intelligence to help us with the delivery of this service. It is built not only to deliver service efficiently, but also to detect and to eliminate fraud. If you are trying to game the system, and there are many who are trying, be aware, you are already in our radar. The system is flagging such attempts, and investigations, as I talk to you, are underway. In due course, and the very near future, the outcomes will be made clear to all, and fraudsters shall face the consequences of their criminal actions. There are facilities that we have no option but to shut down because they are a theater of theft and corruption and fraud. You cannot describe them in any other language. There are health professionals that we will not only cancel their licenses, but we will prosecute them for what they are doing. Because we will not, and I will not allow the fraud that brought down NHIF to follow us into our universal health coverage that we are rolling out. And I know there are many attempts by all manner of people to try and say, oh, you know, this facility and that facility belongs to this man and the other man and the other person and the other person. There is no facility which belongs to no person, no individual that can perpetuate fraud and go scot-free. It's not going to happen. Let's just be, if it is owned by a public official, if it is owned by whoever, we must stick to the straight and narrow. Allow me, good people, to say another two things. We have those in our midst that are not able to pay. And in this architecture, we have committed ourselves not to leave any Kenyan behind. And I want to thank the Council of Governors for agreeing with us that we need to look after these members of society. We have a database under the Inua Jamii program that is not exhaustive. We want to agree with all of you, and I'm very happy that many governors have already stepped forward and said they are ready to pay for 10,000, they are ready to pay for 20,000, they are ready to pay for numbers of citizens, so that no Kenyan is left behind. Every Kenyan should go to hospital, be treated, go home without having to sell any of their property to pay hospital bills. Ladies and gentlemen, excellencies, let me persuade you that health should never be a privilege. Health should always be a right for every citizen. And it is my responsibility and yours, we share equally that responsibility to make sure the dear people entrusted to our leadership in the Republic of Kenya, none of them is left behind. And that is why I want to persuade us. We are willing to, we are actually going to help. And you know, we all know that when we say we are paying for indigents, there will be people who are not indigents who will want to come and be paid for. We have a means testing instrument that will help all of us weed out the people who don't deserve. So I am asking every county to forward to us the people you want to pay for. We will vet for you, and we will tell you these ones, because we have an objective. You know, we've gathered a lot of data, and we have gathered a lot of information, and we have many algorithms that will help us know that this person has sufficient income to pay for themselves, this person does not. We are going to help you so that we can share the responsibility of paying for indigents between the national government and our counties. I don't know whether, Mr. Chairman, I have your concurrence on this matter. Thank you very much. I knew the answer. You know, in politics, you don't ask a question you don't know the answer, because you could get into trouble. So, if we can expedite, that exercise and make it sooner rather than later, we're also going to agree on how we are going to treat the indigents. There will be those that will be paid for, and you know, every person will have a rate depending on their income. There will be those who will be at the base, which is 300 shillings. There will be those at 400. There will be those at 500, like that, continuously. So we will work with you in that process. Then the second thing I want to bring to your attention, and as I do so, to ask for your leadership as county governors. You know that primary health at level 2 in our dispensaries, in our health centers, and in our level 4s, the ones that provide outpatient service. You know very well that that service is available for free for every Kenyan who is registered in SHA. Let me repeat this. Every Kenyan who is registered in SHA should go to hospital in level 2, in our dispensaries, that's level 2, in our health centers at level 3, in our sub-county hospitals in level 4, be treated, be given medicine, and they should go home without paying anybody anything. That is the position. Because we have provided money as the government of Kenya. In this year's budget, we have provided 13 billion shillings that will be paid for every service that is given by every facility in Kenya. There are facilities, and I want to ask for your leadership on this. There are facilities in our counties that charge citizens in health centers, dispensaries, in sub-county hospitals. They charge citizens for treatment or medicine, when actually that and the medicine is already paid for by the government of Kenya. It is not acceptable. So, please, I don't want to mention counties by name because they are there. I just want to ask you that please instruct your CECs and your directors accordingly, so that instead of charging citizens, they should instead use the claim framework and claim for any service that they provide. Because that way, we insulate Kenyans, especially the people who cannot afford, from unnecessary harassment for medical services that they seek in our facilities. Let me also say the following. We have equally provided for money, 8 billion shillings, for emergency and critical care fund. Any accident that happens anywhere in Kenya, those who are taken to hospital, we now have a fund that we can use to make sure that they are attended to. And we again want to ask for your leadership so that we can ensure that these benefits accrue to the people of Kenya in the manner in which me and you have designed it to be. This will go a long way in making sure that we insulate the public from costs that make them sometimes even not go to hospital because they are not sure whether if they ask for money, if they are asked for money, they can be able to pay. Let me also say the following. We have now configured the system so that you not only provide the service, but there is also money in the SHA portal for commodities. And when you claim for the service and also claim for the medicine, because it is all in one package. That way, Madam Wangangi here will be able to sort out all our claims. I wanted to use this forum to seek your support in making sure that we roll out efficiently, effectively, and in an accountable manner this service that we co-designed together. Let me conclude by calling on all of us, my team at the Ministry of Health, all governors, health officials, private partners, and frontline workers to own this project, install the equipment promptly, use it effectively, and ensure continuous maintenance. And let me also say that as we do this, again, together, we must appreciate that health is a shared responsibility, and only through unity and commitment and vigilance will we unlock the full potential and promise of this National Equipment Service project. I will be looking forward shortly to the engagement so that we can deal with the Kenyans who cannot afford the indigents. I think that is a matter that is urgent to all of us. And also to ensure that as we roll out this program, we do not allow fraudsters and people who do not mean well to take advantage of the system, or even those who know what is right and they want to do the wrong things by charging citizens for a service that is already paid for by the government of Kenya. They also do not succeed, because our collective success is the success of our country. And let me say this, the success we are all looking for is not the success of a person. It is not the success of the governor. It's not the success of the president or the health officials or the minister. It is the success of Kenya. Because if we can be able to provide good quality, accessible health to all our citizens, we can be able to take this country to the future faster, much more efficiently, and collectively. So thank you very much, ladies and gentlemen, for listening to me. And I will be coming down to the counties. And there was something that was mentioned about the obsolete equipment, not obsolete, the former equipment of some of them, actually, majority are obsolete. And my good friend Onesmus here said that they are causing a jam. You cannot install the new equipment because the old equipment is still in that space. I have agreed with the vendors that as they come with the new equipment, they will assist you as counties to remove the old equipment. You know? And all you need to do is to provide some storage for them. We can lock them up somewhere. As we, I don't know, is there still any conversation on this old equipment? There are people who still want to have a conversation with the old equipment. And mi nilijiondoa zamani kwa hiyo maneno ya old equipment. Sasa nyinyi kama mnataka kuendelea kuongea, hiyo ni mazungumzo baada ya mambo ingine. Lakini mimi tulimalizana, si ndio? Huyu ngati hawezi kubali, lakini tulimalizana. So wacha kila mtu sasa ajipange vile atajipanga. The story is with who? Haya shauri yao sasa. Sasa vendors mtajipanga. Wajipange. So otherwise mimi nimeshukuru sana. Thank you very much for finding time for us to do this again together. I know you have requested that we should expedite the delivery of the equipment, and our manufacturers and vendors are here. Expedite. That is the request from the counties. Expedite the delivery of the equipment. And Waziri, you have my instruction. Any manufacturer or vendor who has not delivered or is behind schedule, give them a warning letter. If not, we will move on to the next supplier so that we expedite the process. I know also some mention has been made of the level 2 and level 3 equipment. I think we are also agreed on something called framework. The one you are supposed to pay, I was offering to pay 30% and you pay 70% over 5 years. No, that is not the agreement. No. You know, you want to shortchange me now. That is not the agreement. I remember very well. And you know, this is what I said, that I will pay the 30% upfront, but you will pay the 70% over 5 years. You know, it's a very fair deal. And you see, I don't have to. It is your equipment. I'm just helping because no. First, these ladies should not be talking because it is very difficult to argue with the ladies. They use intimidation. So we will, I think we made a deal. If there is need to negotiate that deal, let's have another conversation. Nyuma ya tent. Tutaenda huko nyuma ya tent, tutaenda kuongea how we need to do that. But my instructions to the ministry is that framework agreement, if it is not moving in the manner in which we agreed, let us re-advertise if necessary. So that, because I want also, because as has been said here, there are conditions like cancer that we need to attend to at the very earliest possible time. Yeah, so again, we should be able to do that. Is that okay, Bwana PS? Yeah, so again, I know there is a team which normally works collaboratively between the ministry and the council. If you can engage, and then we see how to take that forward. Otherwise, I cannot find a better way of collaboration than what I see between the Council of Governors and the government of Kenya at the national level. I mean, it just points to leadership. We all know that we are serving the people of Kenya. It is not who gets credit. And for me, I am not interested in credit. Everybody should take all the credit. Whoever wants credit should have it. But let us just do the program. I think that should. So let us let's do this together. So please, my team at the Ministry of Health, let us expedite. Your Waziri and your 2 PSS, please, we expedite. I think that is the language we are getting from the Council of Governors. Let me also say that you have my commitment on making sure that we deliver on health commodities as well. Bado tuko na mazungumzo kidogo kuhusu KEMSA. As I told you, we have provided additional financial infrastructure for KEMSA. We must move the refill rate from 40% to 100%. We must do it. And we must do it in the next 3 months. It must be 100%. No citizen should go to any facility and fail to get medicine. Because you all understand, tukiongea na wananchi kwa baraza, tukisema tu hospitali, wanasema hakuna dawa. Si ni kweli? So this hakuna dawa thing, we must deal with it. And I have given very clear and very firm instructions to KEMSA. The CEO is here. You know what stands between you and your job. I have told him. Sijamwambia mambo ni matatu, lakini I have told him something. I have told him something. So, my good friend Wako, yeah, the refill rate must be 100% in the next 90 days. You have all, I have given you all you need And Waziri has given you the support, all the support you need. The board has given you all the support you need. And these county governors, their first port of call when they are looking for medicine is KEMSA. So don't let them down. You know? And you are paying your debt, yeah, to that place. But we just need to agree, we just need to agree that the same way we are agreeing that let us pay for this equipment without going through hoops and jumping, you know, hoops and corners, let us also see how we are going to, and I know there is a present engagement to see to it that we pay KEMSA using SHA. We agree on what kind of agreement that needs to be put in place. Chair Emeritus, umesikia hiyo nimesema? So thank you very much. Let me also say the following. Sorry, you know, the older you get, the more many things you remember. You know, many governors had asked me about matters to do with bursaries. You know, I know you now know that we have provided a framework agreement which we have signed, and because the same way we are working together in health, we are also working together in education. You know, education may be a national government function, but we realize the importance of counties and the role they play in making sure that access is made possible to students who otherwise their parents and financial status could not support. And that is why we have signed the framework agreement, and all of you now can give out bursaries for all our students in all levels of our education. Again, it points to cooperation and collaboration as the Constitution mandates us to do. And I must say thank you very much for what you're doing. Asante sana. Yes, Governor says.
We also have a problem with the conditional grants, Your Excellency.
Yes.
The amount we are expecting before the year closed, you only given 10% of what you are expecting. And then you are told in the new financial year, you will get the balance of the last financial year and still get for this financial year. But the information we have, especially from agriculture, is that they are not giving us any more. Let me give you an example. I was expecting 152 million under NAV CDP, and we had already done all the preparatory work for the things we were to do. We had engaged the farmers, the SACCOs at the ward level, vaccines. Now we received 38 million before the end of the financial year. And our guys were called, the chief officers in charge of NAV CDP, and told, by there, this is all you should expect. There will be no more coming from the last financial year. So we don't know why Treasury has decided to withhold that money, Your Excellency. And na tulikuwa tumepanga yote, Your Excellency. So we look like we have cheated our people.
Okay.
Yes.
You know, no,
Your Excellency, I think you get it. You remember we had this discussion.
Yes.
What was passed as the C gap, which became the County Additional Allocation Act,
Yes.
was not fully appropriated in the national government budget. And there was the question of the ratios that we had to meet. You
Chair,
understand?
I understand.
Yeah.
In fact, we had a conversation on that matter.
Yeah. Thank you.
Because I think, again, this is a matter we should take offline so that we can have a conversation. What I can guarantee you is that all the money that we needed to pay by end of this financial year on all the other matters was disbursed. True or not true? We disbursed all the money. So we need now to come and have a conversation on this additional conditional grant so that we can find out whether it is the donors or what, and then we can see how to deal with it. Sawa sawa. So I think because we are on another event, and I think there are citizens watching somewhere else, let us keep this matter to this occasion. You know my address. When when you want to engage me, and I normally, I'm very generous with appointments going to governors, because I know you run our counties, and you need attention whenever you do. So we will, and by the way, we will be attending the devolution conference on next week. So if you want a side chat, we can do a small impromptu IBEC or summit at the corner. So we can do that next week. Is that okay? So asanteni sana. God bless you.